This is the third day after this patient went through facelift and upper blepharoplasty surgery.
So what do you watch these days?
I watch on Netflix, you know.
If your upper eyelid tends to get droopy, making your eyes look small and stuffy, Mina Plastic Surgery recommends upper blepharoplasty. Dr. Cha designs the outcome considering the sagginess. As you age, you will experience sagging of the skin as well as the appearance of wrinkles and folds. A lifting will lead to a reduction of sagging skin as well as double chins. SMAS lifting is lifting of the superficial musculoaponeurotic system, placing sutures in the SMAS layer and the platysma for tightening. At Mina Plastic Surgery, SMAS lifting not only lifts the SMAS layer but also gets rid of loose and saggy muscles under the skin layer. Therefore, SMAS lifting can create a permanent lifting effect.
The stitches were really okay.
Yeah.
So could you stop? It's very clean and being mature, like properly. So could you make a Saturday if you have time?
Oh, really?
And if you don't have,
I'm not doing nothing. This is my priority. So yes. Saturday is perfect, and whichever you think I'll do.
So we are going to remove the stitches like partially on Saturday if it's mature.
Okay. I know this side feels more swollen.
Oh, but that's usually normal.
This is a red light therapy. It's part of post-surgery treatment to boost and speed up the recovery.
Okay.
So 2 weeks for the liposuction and 12 days for the eyes. Eyes and facial areas. Now, the eyes, we have a long way to go.
Okay.
But still, we're going pretty fast.
Yeah.
So can you try to open without raising the brows? Yes, like that. So it's been your habit for a long, but you don't have to like open.
That's what my husband keeps saying. You keep going like that.
Maybe that's why it recovered pretty fast. So the eyes are open much more.
Yeah.
And can you close your eyes? It's closing all the way, right? All right.
You know, this eye.
Yes.
Certain times I feel like inside there's something, you know, like there's tissue that's sort of rubbing and trying to heal. Is that true? You know what I mean?
Yes, that's normal.
And then it's like it almost there's like an eyelash inside, and I know there's not, but if I sort of just massage it a little bit, then it's sort of like
There are certain places.
yeah, you know. And so I'm thinking that tissue healing in the inside.
Yes, all that is going to get worse
Worse?
for 4 weeks, and then it's going to fade out. Now that's because all scar tissue, they get very firm, very hard,
Okay.
very pigmented, and hypertrophic, contracted, all of it at the same time.
Yeah, I feel
That's
like
going to, yes, here, right here, and in the body areas. In the facial areas, it's peaks of its maximum between 4 to 6 weeks after the surgery.
Okay.
So, now it's going to get a little wrinkly along the incision line. Then it's going to get a little darkened and then fade out. All of it is normal.
Okay.
That's the way of scar maturation. So at first you may not have felt that, but then starts to come,
and
right?
then I think, okay, after I'm coming down and feeling something inside, and so it makes my eye tear.
Yes.
Only one side, and so okay, because it's on this side, I think it's part of the healing process.
Yes. So all that is going to get a little worse. So this side is going to follow.
Okay.
Now that's aside from the swelling going away. Swelling is going to go away, but the scar maturation process is going to get worse and then fade out.
Okay.
Okay. Now in the body areas here, the trunk area, that it usually peaks last on about 1 to 2 months after surgery. So it's going to feel like a leather. Very hard.
I'm feeling it in my leg. The
Yes.
little lumpies.
Yes.
Yeah.
Yes, that's going to get worsened, and then it's going to fade out.
Okay. And it's very itchy.
Yes. Itchy means it's good, yes. And the facial area seems to be like we still have a little bit of that that's going to reduce a lot more.
Okay.
It's just but then it's all refined, so we don't have.
Yeah, I think it almost felt like you got punched in the jaw.
It's a little,
yeah. So thank you.
Okay, enjoy the flight.
Well, I'm so glad I met you and thank you so much for everything.